Hi, I'm Dr. Mila McManus, founder of the Woodlands Institute for Health and Wellness, and today I'm going to talk about adrenal fatigue. It's also called adrenal burnout, adrenal insufficiency. As doctors in medical school, we don't learn about adrenal fatigue. We only learn about the extremes of adrenal function, such as Cushing's disease, which is an extreme overproduction of cortisol, or Addison's disease, which is an extreme underproduction of cortisol. Adrenal fatigue, I like to call a relative cortisol deficiency. So it's typically not picked up on blood tests. And this is something that, because we don't learn in medical school, most doctors aren't familiar with. They don't know how to diagnose it and they don't know how to treat it. So hopefully I'll shed some light on that today. Your adrenal glands are two little glands that sit above your kidneys, and they produce a lot of different hormones. I'm going to focus on cortisol today because it's the main hormone that's affected with adrenal fatigue. Cortisol has vital functions in the body. It helps to maintain your blood sugar, your blood pressure, your immune function. It's your body's natural anti-inflammatory, and it's a stress hormone. So let's say that one day you woke up late, you used up all your blood sugar stores at night while you were sleeping, because we don't eat when we're sleeping, and you didn't eat breakfast, you ran out the door to get to work, and your blood sugar level starts to fall. Well, if your adrenals are functioning properly, cortisol levels will raise up your blood sugar for you to compensate for that until you do eat lunch, and then cortisol levels can go back down to baseline production. And then another example would be, let's say you get dehydrated. You were at the beach all day, you ran a marathon, you were just so busy, you just didn't drink enough water throughout the day. And when you're dehydrated, your blood pressure tends to fall. And so as that occurs, when your adrenals are functioning properly, cortisol levels will rise, clench those blood vessels down tight to keep the blood up in your head instead of draining out, so you don't pass out until you get rehydrated, and then cortisol is not needed, so it'll come back down to baseline production. And then let's say you need your immune system for something. Let's say you had surgery and you need to heal up a wound. Cortisol levels will rise and help modulate the immune system, offer its anti-inflammatory effects to heal the wounds, etc. And then we come to the example of stress. Stress is a big factor with causing adrenal fatigue. And I like to kind of take this back to caveman days. When we were cavemen, all we really had to worry about were lions, tigers, bears, and where we were going to get our next meal. So now forward to today, and we're sort of all surrounded by these tigers all the time. Lions and tigers and bears. Now, we all have different lions and tigers and bears. Your tiger may be that you don't like your boss and you have to work with him or her 80 hours a week. Or you may be raising 6 children who are all ADD. Or you may be taking care of ailing parents. Or you've been a huge victim of an economic crisis. And the list goes on. We all have these lions, tigers, and bears all the time. So we can't necessarily get rid of our stressors, but we do need to learn to cope with stress so that we are sort of lifting that burden off of the adrenal glands. But I encourage you again to visit our website. It's twihw.com. And again, I'm Dr. Mila McManus for the Woodlands Institute for Health and Wellness, signing off. Thank you.